My name is Nikki and I'm a certified medical assistant with Houston Skin Associates. Today I'd like to talk to you about the importance of skin cancer and melanoma awareness. So there are a few things that we want to educate you guys on what to look for if you happen to have a lot of moles or things of that nature. They are called the A, B, C, Ds of melanoma. A is for symmetry. What that means is your moles should honestly look the same on both sides. One side should not look different from the other side. B is border irregularity. And that, what we look for is if the borders of the mole or if they're jagged, uneven, that is border irregularity. C is color variation, meaning, say for instance, your mole can be dark brown, but you notice that on the outside there may be different colors. Sometimes those colors can be red, light brown, a darker brown. That is color variation within. And D is for diameter. Your moles should be uniform in size and color. Usually about 1/4 millimeter, which is about the size of a pencil eraser. So if your mole for many, many years has remained the same, you're okay. But if any of these changes happen, the best thing to do is actually get in and make an appointment with your dermatologist. 9 times out of 10, that's an abnormal mole. One of the things that's really important for us to stress to you is if you have had a history of skin cancers, and you know the 3 skin cancers are basal cell, squamous cell, melanoma, it's really important that you follow up every 6 months for a full body skin check. If you have not been diagnosed with a history of skin cancer, it's good for you to actually get in with your dermatologist at least once a year. And some of the things that we teach our patients are the sun protection. Of course, you know that skin cancer, people have this notion that skin cancer comes from, well, I don't go out in the sun a lot, and that's really not true. Studies have shown that skin cancers come from your sun exposure, and it's actually the sun exposure you had as a child. Basal cells, the most common skin cancer, studies have shown that they come from past 20 years or more of sun exposure. So at any point in your life, you were a child that was outside and you love the outdoors. As an adult, it is very, very important, especially if you have moles, family history of skin cancer, or you've had a history of abnormal moles, get in and get checked. Sun protection isn't just sunscreen. Sun protection can include hats, wide brim, not the nice stylish hats that we like, but wide brim hats that actually cover your face. Sometimes they can even go out to your shoulders, which is awesome. You do have your UV protection clothing. You can get that from Academy. I personally like Academy because they actually come in different colors. And that's to be worn, especially during the summer months. I personally like to dress myself and my children in the UV protective clothing that literally covers them everywhere. The other way is sunscreen. One of the things is we think, oh, we cover you with sunscreen, we'll let you go, and you've been in the sun all day. That's almost like not putting any sunscreen on at all. What you want to do, study has shown that it's actually best to apply sunscreen every 1.5 to 2 hours that you're in the sun. So if 1.5 hours passes, and then also, you know, we jump in the water, we play in the pool, that sunscreen washes off. So anytime the child or yourself get out of whatever body of water you're in, it's always best to actually reapply your sunscreen. Every 1.5 to 2 hours you are exposed to the sun. So to schedule an appointment with one of our board certified dermatologists or physician's assistants, you can give our office a call at 713-528-8818 or online at houstonskin.com. We offer same day and Saturday appointments at any of our 4 locations.